You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, Dr. Keadle. Dr. Keadle, welcome to the program.
Thanks for having me, Randy. I appreciate it.
Now, before we get into today's topic, in your practice, because I guess you do more than just dental implants, who's your typical patient? What are the different services you offer?
I wouldn't say that we have a typical patient. You know, what I'm really here to talk to you about, and I'm most excited about, we've been seeing more and more people who have a loose denture, or they have teeth that are going to have to come out, and they know that, or they have teeth that have already come out, and you know, they want a fixed set of teeth. And so we're doing more and more and more of that, and I'm very excited about it because I don't think anybody ought to be, you know, like you just said, wearing a loose denture.
Good. Dental implants.
Right.
I guess there's two categories, or two main categories. People that are headed to dentures.
Right.
Their teeth are falling out, I guess, or in
Not
bad
necessarily
condition.
falling out, but I think if people are having trouble with their teeth, and Randy, you can't believe the people that come in and they tell me, you know, I'm in constant pain. They tell me I can't eat what I want. They tell me my breath smells, you know, all these horrible, I can't kiss my wife. I can't begin to express to you just how miserable these people are. And so we sit down and we say, look, we have answers for you. We can fix this. And I think it's we hear a big sigh of relief a lot of times, just when they kind of figure out that I'm going to be able to help them.
Okay, good. And the denture wearers, do they benefit the most? I guess they're hard to reach sometimes because you say...
Well, look, people, denture wearers, they don't even come into the dentist most of the time. So usually when I see them, they've either heard somebody tell them, hey, listen, I got a fixed set of teeth and it's much, much better. Or they've come in because they've got a broken denture, or they've got a problem with their denture, it's too loose. You know, maybe you know all the problems that denture wearers have, but...
So where you are there a lot of people wearing dentures?
Randy, there's a ton of people wearing dentures where I am. I think you could fill Panther Stadium with just the people in my area that wear dentures. So yeah, it's a lot.
So if it's so good, why aren't they all doing it? These denture wearers coming in and getting them attached, I guess, to dental implants.
Right. I think there's probably at least, I'm thinking of about 5 reasons. You know, and the first is just they don't know. They have no idea, you know, that there is an option available for them to get them a fixed set of teeth. When you get dentures, you don't go to the dentist. You don't need to go to the dentist.
Yeah.
Right. So unless you have a problem with your denture, which is, you know, fairly common, but people, often I see people that fix their dentures in their garage rather than go to the dentist. That's how much they hate the dentist.
Is that right? They fix them in the garage?
Believe it or not, yeah.
Like what?
Not very well.
Smoothing them out or
super glue, they sand on them, they file on them. They're miserable, of course. I mean, they're trying to do anything they can to one, get a denture that actually works for them, and 2, avoid going to the dentist at the same time. So here you are with a file in your garage.
So is this true that in your office they could come in, okay, they're sedated,
yeah,
IV sedation.
Sure. If they need it, sure.
And they could go in without teeth, and they could walk out with teeth.
Absolutely.
Is that right?
You walk in 7:30 in the morning, you have either a denture that doesn't fit very well, or you have teeth that are completely unfixable, and you walk out at 3 or 4 in the afternoon and you have a new fixed set of teeth that looks just like mine or yours. And the third reason is I think a lot of people just think that they're not the right candidate. They think they're too old, or maybe they think they have a medical problem.
So how old can you be to get this done?
Well, Randy, you can be as old as you want. I mean, the studies have proven that the success rates for old people and quote-unquote young people are really about the same. You know, and I think about my aunt. My aunt was 92 when we did a lower fixed set of teeth for her. And
so like a full arch of teeth?
Full arch of teeth. She's 92.
Really?
This was years ago, and I wasn't really sold on it at first.
So you were even nervous?
Well, I wasn't nervous. I just was like, Aunt Ida, why do you want to fix
why
set of
would
teeth?
she want to do it at that?
Well, she got a little bit indignant with me, Randy, honestly, and she's like, you know, I want to eat just like you want to eat, Doc, you know? And she's allowed to act that way, I guess, with her nephew.
Yeah.
But now, you know, once we did it for her, I get it. She was so much happier. It changed her life, really. Because now she could eat some fried chicken. She could eat cucumbers in her salad. You know, she could chew a steak and get that juice out of it that we all get. Yeah, unbelievable, really. I kind of felt ashamed that I ever suggested not doing it. And the thing about Aunt Ida is that she is everyone. You know, everyone that has a lower denture that doesn't fit or an upper denture that doesn't fit is in the same shape. You know, they have to chew their food like a cow. They can't
like just rubbing it together. Is that what you mean?
That's the only way you can, because they, you know, the dentures flop around, they move around. You don't have any choice. You know, but when you fix them in place, then they can eat like you and I eat. They can go to a restaurant. They don't have to worry about laughing and their teeth falling out. They don't have to go to the bathroom and clean their teeth in the bathroom.
So is your idea, so I get this straight, that if you're wearing a denture, you could come in and get them attached to something, locked in?
Absolutely. And that's the big difference, is that when you use implants, you're attaching those teeth to the bone, to your jawbone. That force is going through into your jawbone, and it's also keeping them from, obviously, like I said, coming out in an embarrassing situation. This is the way of the future. There's not going to be any more dentures. 20 years from now, there's not going to be any more dentures.
The way we know them today.
The way we know them today.
They'll all be attached to something.
They'll all be attached to something.
What about pain? It does seem painful.
It's not painful at all. You know, obviously we have to numb people so that, you know, they don't feel it while we're working on them, and we give them whatever level of sedation that they need to be comfortable in my office. We're going to make you comfortable.
If they, like you say, you can do it the day of the procedure, they can walk out with teeth, right?
Absolutely.
How soon can they eat?
They can eat literally as soon as the numbness wears off, that evening. You know, we had a lady call us a couple weeks ago, and she literally called us up, and you know, the gal on the phone's trying to figure out what is it that she wants. She just wants to tell us that she's eating fried chicken at lunch with her girlfriends, right?
Is that right? Good.
She's about 65 years old. She goes to a luncheon, and for the first time in I don't know how long, she's able to eat fried chicken. So she gets done with lunch, she calls us, and she just wants to tell us. And you know, those are great stories when we hear those.
Isn't it true, though, that if you have dentures and you've been wearing them for 30 years, that you don't have enough bone to get this done?
No, that's not true at all. And I get people sometimes, they come in the office and they've heard that. They've heard that somewhere, whether a friend told them or the internet told them, or you know, maybe another doctor's office even told them. But you know, that's that doctor weighing in on what he can do. But that doctor may not have the imaging that we have. That doctor may not have the experience that we have, not know how to find that bone. But I have yet to meet someone who didn't have enough bone to do a fixed set of teeth with implants.
So you could always work with them. Plus you have bone building
yeah,
stuff,
if we need
material?
it. Most of the time we don't need that. Most of the time we can take as little as 4 implants, put a complete arch of teeth on just 4 implants. We don't have to do any grafting. We don't have to do any of that. And they get us a fixed full arch of teeth to eat with.
Now what about the people, though, that have bad gums? Can they do this?
Absolutely, and that's one of the bigger groups of people that we end up having to do this for, because they've got a gum infection, Randy. The thing is, when we get those bad teeth out, we get that gum infection gone. Now that infection's cleared up. You
know, and you have said that you're changing people's lives when you give them their teeth back. You believe that?
Randy, they tell me that we're changing people's lives. I mean, I'm thinking of this young man. He was about 35 years old. He came in, his mother and father got him to come in and see us because they said, listen, doc, he's not interacting with people. He plays video games, he has a job, but he doesn't smile at anybody, he's not dating. And we think that if he had a better smile, that it would make a difference. And it did. You know, now we see this guy, he comes in for his recall visits, he's smiling, he's happy, he's dating again.
Is he off those video games, I hope?
I think so.
I'm joking about that.
No, I think he really is. I mean, because he's got better things to do with his time. And he's not afraid to go out into the public and do what it takes to have fun and to meet people and to enjoy his life. And Randy, you can't do that if you're not able to smile, or if you're ashamed of your breath, or if you're embarrassed all the time. I mean, really, when you talk about a person who's in their 60s or in their 70s, and here's what I hear from them is, you know what, doc, I'm not able to go out and rollerblade. I'm not able to go out and play tennis. Maybe some of the really older folks, but you know what? You know what you're still going to be able to do when you get older? You're going to be able to eat, and it's going to be a big part of your life. And I'll tell you something else. It makes a big difference in your health. We literally see over the course of 3 or 4 years a big change in people's health as they're coming in for their recall visits. See, their doctor told them to eat something for fiber, for instance.
Yeah.
Well, look, if you're wearing a denture, you can't eat fiber. You can't chew a salad up. You can't eat the necessary things to keep yourself healthy. And you know, when you get older, you want to be healthy. You want to live a good life. You want to be able to eat and eat what you want to eat.
So 80s, 90 years old, like you said, your aunt.
Absolutely. My aunt, 92.
92.
Aunt Ida in Roanoke, Virginia.
What was pain like for her, by the way?
Not bad at all. Again, look, it's surgery. Everybody's going to be a little bit sore, but you're not going to have any trouble while we're doing it. You're going to have a little bit of soreness afterwards, which is to be expected with anything, but it's not bad at all. You know,
and
you're
the
able
smile,
to eat the next
by the
day.
way, you think the smile is probably one of the most important things because you're a dentist.
No, I don't think it. Studies have shown, they did a twin study up in Cambridge, and they took two twins, and they both went in and applied for a job. All right, one of them was instructed to smile. The other one was instructed to just keep a normal demeanor.
Yeah.
What do you think got the job every single time?
The one smiling.
Absolutely. Yeah, I mean, it's huge. And you don't just smile with your teeth, you smile with your eyes, you smile with your body, you smile with your whole persona. A smile is huge. It's been shown in study after study after study. I have not seen a study on this, but I'm convinced that it makes a difference in whether you get a promotion or not. And I don't really know how they do that study, or I maybe even would try to do it.
Well, when people, I guess, appear to be happier and enthusiastic, and when they smile, yeah, I could see, obviously that makes a big difference.
Sure.
Are there a lot of people that don't smile because of their teeth? I mean, it sounds like an obvious one, but do you see it because you're a dentist? Like, can you tell when somebody's hiding their teeth?
We see it because we see what the difference between when they come in for their consult. Back to your original question, you want to know, what difference can a smile make? I'll tell you this. My wife has to travel internationally with her job, and she only speaks 4 languages. So that leaves her, in a lot of countries where she can't speak the language. And you know what she tells me? She says, "Listen, Doc." She doesn't call me Doc. I shouldn't say that. Everybody else does.
Okay.
I should make her call me Doc. Anyway. But she says, if I smile, you can't believe the doors that opens for me in places where I don't even speak the language. And so I know this to be true, even if you're in another country and you don't speak a word of whatever, Swahili or wherever you are, you can smile, and that's probably going to help you find your way to the bathroom or whatever it is you need.
Makes you more approachable.
Absolutely. Yeah.
Things like that.
Maybe get you out of a traffic ticket.
Now, you said that there are people, we talked on the phone, that there are people out there that are married and their spouse doesn't even know they have dentures.
I hear that.
Is that real?
I hear that all the time. The wife says, "Listen," because sometimes we end up doing a denture or whatever, and the wife says, "Well, when, do I have to take these out?" And I say, "Of course you have to take them out, because with dentures you have to take them out to let the tissue rest. With a fixed set of teeth you don't." And they don't want to take their teeth out. And then of course I hear the stories where they've had dentures made and we're coming in and we're fixing things, and they say, "Oh, what a relief this was that I don't have to hide the fact that I wear a denture from my spouse." Now listen, I know that their spouse knows, and I think maybe deep in their heart they know their spouse knows, but they really have spent maybe 10, 20, 30 years trying to keep their spouse from even knowing they have a denture. And that's just, that's kind of...
It's like having a little secret.
It's an awful little secret.
Especially dating. That's got to be tough if you're in your 60s, 70s dating and you're wearing a denture.
I think it would have to, it would have to be much tougher dating than if you were already married. And
what's the answer?
What's the solution? Come in, get a full arch of fixed teeth. They don't come in, they don't come out. You don't have to wear adhesives. You can eat what you want. You can smile when you want. You can go to the parties that you want. You can date who you want. I mean, to me, it's a no-brainer. So
if a patient goes to you and they've been told their teeth have to come out, and I guess one of their options is dentures, but and for the denture wear, if they go to your office, what are their options when it comes to dental implants?
Option number 1 is 2 implants, okay? And so the denture snaps in, the denture snaps out. It's fixed in place. And
where do you put those implants?
We just put them like right here and right here.
Okay.
Yeah, just right up in the front
So
here.
a full arch of teeth?
Right.
That just...
It snaps in, snaps out. It keeps it in place and helps you to eat, and it does much, much better under that circumstance. I had a lady, this was about 2 years ago. She had to have her teeth out. She wanted a denture. We made her a denture. She finally calls back and she says, hey, listen, doc, I'm ready for something a little improvement. And so we did that. That's been about 6 months ago. She's happy as she can be. Now her denture snaps in, snaps out. Much, much better, much improved.
Is that what you call them, snap in, snap out dentures?
I call them snap in, snap out dentures, yeah. You know, so it's a full arch of teeth that snaps in, snaps back out. It doesn't come out unless you want it to come out, and that's the big deal. What we really see the biggest improvement with is when we go to a full arch of teeth that's fixed in place. We just need 4 implants for a whole arch of teeth. We put that in there. Those people can eat just like you and I can eat. They can do anything that you and I can do. They can bite all the way through.
Could they use their front, like if you do the upper and the lower,
yeah.
Can you bite like a carrot with your front teeth?
They can bite right through a carrot that hasn't been cooked. They can bite into an apple. They can, tear a sandwich in half. They could probably open a beer bottle, but we tell them not to do that, please, just in case. But I would tell you that too, not to open beer bottles with your teeth.
So they're strong. How long do they last?
They last as long as teeth would last.
So they could last the rest of your life?
As long as you do, hopefully. Yeah. Yeah. I had this one lady. She only had 2, snaps put into her denture. This was an upper denture. She couldn't wear a denture at all. So she came to me with no teeth whatsoever. And you can imagine a 50-year-old woman that didn't have any teeth, how upsetting that was for her. She'd been a lot of places. They couldn't help her. She came to me. We told her we could find a way to help her, and we did. We used our CT imaging. We found some bone. We put 2 little snaps in there. And her problem was, Randy, she had a big bony protuberance in her palate, up in the roof of her mouth. Well, she couldn't wear a denture. So we had to make her something that didn't need a palate in there. And that's a big improvement, even for people who are able to wear a palate. When they take that palate out, Randy, now they can taste things. Now they can speak better because their tongue has to fit up in the palate so that they can make their S's better. We always try to get people to say, sit and shift and shift and sit, and nobody ever wants to do that. But we do.
If you're wearing a denture, it's tough?
It's tough anyway. And
it makes you laugh.
And accidents can happen, but it makes them laugh. And then we say, say 77 Sunset Strip, and you can't really do that well if you have a palate up in there. Your S's don't come out right. And everybody wants to have their S's come out right, I think. Here's the best part of my day, Randy, is at the end of the day, when we're waking somebody up from their sedation and they've finally gotten themselves awake, and we've got them all cleaned up and they're looking good, and we sit them up in the chair and we hand them a mirror. And sometimes they have their family around and sometimes they want to be by themselves, but invariably we will get a smile and we're afraid they're going to break their face. That's how big this, no, I'm not joking with you. We're literally afraid something, just like, don't smile that big because we just finished working on you. But they're so happy, and then sometimes we get a tear because some people have been so, depressed about the state of their teeth. And then when they see that, they literally get a tear and they go, now I look like everybody else. It's that right there, that minute and a half is worth all the work that we do for all these people, and we do it a lot just for that minute and a half. We like the phone calls where they
So when they look in the mirror, though, and it's very exciting.
It's almost impossible to describe to you the feeling that they get and then the feeling that the staff gets, because we all gather around. I mean, we stop whatever we're doing because we want to be in the room for that. And it's almost magical, and it's just a poignant moment when someone who hasn't been able to smile suddenly looks in the mirror and they realize this is the first day of the rest of my life, and now I'm going to go out in the world, I'm going to smile at people, and they're going to smile back. They don't have to hide anymore. I don't know how to put it.
Do they look real? I mean, because I feel like I could spot a denture walking down the street.
You can't spot this.
Really?
You absolutely can't spot this. No, I mean, these look just like your and my teeth. They look better than my teeth. They look about like your teeth. No, really,
okay.
I mean, yeah.
So and we're gonna take a quick break.
Sure.
When we come back, more about the process and what people could expect. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I didn't like to take that thing in and out of my mouth every night, the plate. Whatever you did, you're always conscientious, is it gonna fall out? When I'm talking to somebody, or if I'm eating something, is it gonna fall out? I went to other different dentists to get their opinions, and no one had the vision that like Dr. Keadle did with his info commercial. My wife saw it, and I immediately picked the phone up, called him, made an appointment. We both came up. From the time I got here to the time I left with my permanent teeth in, everything was perfect. I mean, the experience was flawless. I feel like I was just born with my permanent teeth. You know, I mean, it's awesome. I wasn't in a lot of pain. If you want your real mouth, this is the treatment. Anything with a temporary plate or plastic in your mouth, you're not eating food correctly. You're not tasting things. I mean, you're not kissing your wife. You know, I mean, there's so many positive things with having the real teeth. You know, and that's what I feel like right now. This is top and bottom, hands down, the best thing that I've ever done.
Well, I've always had pretty much trouble with my teeth all my life. You know, it's a hereditary problem. My mom had problems with her teeth, and she, you know, got false teeth, and I knew I was destined for that, unfortunately, but I didn't want that, but I knew I was headed for it. And I saw Dr. Keadle's infomercial on TV one night that showed he had implants that I could use to where I didn't have to just like pop in a false teeth and go with it. Went through the process, got everything done, and then today I came in and got my teeth in, and it's absolutely a godsend. You know, I've got upper teeth. I haven't had back teeth in years, and this is awesome. You know, the snap-ins, they're in there. They're like regular teeth. Like I've got just regular teeth in there again. No, like false teeth would be, but this is just awesome. I love the fit. The fit is fantastic. The smile, I've got a smile again, and I'm loving it. It's perfect. It's just exactly what I wanted.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says, no more dentures. So you don't think anybody should be wearing a denture? I mean, I don't want to put words in your mouth, but you don't really like dentures.
I loathe dentures. No, I absolutely don't like dentures. And let me just tell you, George Washington, our first president, used to ride a horse to work, and he used to wear dentures on his way to work. Now, nobody rides a horse anymore, and I don't know for the life of me why anyone would be wearing dentures, because we have a way to not have to wear loose-fitting dentures anymore.
So is your goal then to wipe out dentures in your city?
That's absolutely my goal. I think we can eradicate dentures in not just in my city. We draw from an hour away. Sometimes people drive 2 hours to see me, and you know, so I'd like to eradicate dentures
so
worldwide,
traditional
frankly.
dentures. So again, for people just tuning in, they can go in, and on the day of the procedure, you can give them like 4 implants, get a full arch of teeth that don't come in and out.
That's absolutely right.
And they can walk out that day with teeth.
They walk out that day with teeth. They can eat the next morning, just like you and I eat.
Is this one of those things where the patients will say, I should have done this years ago?
Yes, it is absolutely one of those things. Patients say, I wish I had done a snap-in, snap-out, or I had done a fixed set of teeth years ago every single time we treat somebody. But sometimes, you know, like we had a lady, she had lower natural teeth, so she came in to get them clean, and she had an upper denture. And every time she came in, my hygienist and I would say, hey, listen, you should consider, you know, doing something about replacing that denture with a fixed set of teeth. So finally, her husband insists that she come in, get a consult. She ends up doing it. And
doing what? You gave her a full arch of teeth?
And we gave her a full arch of teeth.
That don't come in and out.
They don't come in and out. She's happy as a clam, but I kid you not, she comes in and when we're talking about it, this is like 6 months later, at a recall, and she says, you know, Doc, I don't know why you didn't mention this earlier. And we begged her, you know, to come in just for a consult. And it's just a consult, right? I mean, come in, see what your options are. We can put you in a fixed set of teeth. You're going to be happy. Everybody has been. Every single person has said, I wish I'd have done this years ago.
So I know this is not possible, right? But if you said, okay, denture wearers out there, come in, try out some implants over the weekend, right? Giving them a fixed set of teeth.
They would leave their fingernails in the door jambs if we tried to take their fixed set of teeth back after they'd been wearing them for a week.
I guess you're not too old. Pain is not something that you think.
Nobody's too old for this procedure. I know people think that, but the studies they show differently.
So
and
80, 90 years old?
80, 90 years old, that's not a problem at all. And that's the majority of our patients are probably in those middle years, but we see people as young in their 20s sometimes that have had trouble, and we see people that are in their 90s and they say, listen, doc, a day is a day. And I'm not going to spend another day not eating what I want and not going where I want and not doing what I want.
I want to ask you, so with the snap in, snap out, full arch of teeth,
sure.
Can they eat like pizza? Like a chewy thing?
Randy, you can eat pizza with pepperoni and sausage and mushrooms and anchovies and whatever you want. I mean, I'm a cheese pizza guy, but some people like all that stuff. And if you got a snap in, snap out denture, or obviously with a fixed set of teeth, you can eat all that stuff.
Okay, good. Now we are out of time, but I know you wanted to show me that for some reason. What is that? What are we looking at?
Well, this is an example of a snap in, snap out denture. You got we put 4 little snaps in here, and then we put 4 females in here in the denture, and then now it stays in place.
Let me see this. Okay, so this is an accurate representation of what they'll get. So this is like a lower or upper?
That's a lowered snap in, snap out set of teeth, and it snaps right into your jawbone, just like that. Now try to pull that away.
Okay.
You see what I mean?
Yeah.
Yeah.
My hands are a little greasy though.
Well, you can.
Now, what about somebody with arthritis? Is it tough for them to get these out sometimes?
I'm going to be honest, it is, but they learn it. It takes them, 5-10 minutes of us just saying, hey, try this again, and they get it, and they learn how to reach in there and get them out.
So you can adjust it. You can adjust it.
Yeah, and we can adjust it. We can adjust the tension on it so that it comes out easily. But
so don't put it off.
I wouldn't put it off.
So final statement.
Yeah.
Patient watching this, they have no teeth or their teeth. They haven't been to the dentist in 15, 20 years. They think they're too far gone. What's your recommendation? What's the first move?
Pick up the phone. Call me up. My appointment secretary is going to make you an appointment, and it's going to be a free consultation. We're going to mess with you. We're just going to sit down and listen to your problem, and then we're going to figure out how to solve it. Okay, good. Now insurance, we should mention. Insurance here in the U.S. does not cover the whole thing with dental implants, but and Medicare doesn't take care of the Medicaid. Let me just say, Medicaid does not cover this at all, but to the extent that your insurance company will cover implants, my people know how to get that coverage. But I do have to say it's very little coverage on these kinds of procedures. And you have financing available? Yeah, of course we have financing available. So you can spread this out over months and years. So free consultation. And they get to see you? They get to see me, absolutely. Yeah. All right. Thank you for coming on the show. Very thanks good, for having me. Appreciate it. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health. Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.